One of the questions we have to ask is, did you lose a loved one in the fire? And she paused, and then she said, does suicide count? And that was one of the hardest calls I've ever done in my life.
Mental health risks are becoming more of a reality for many in the Butte County communities where the Camp Fire burned last year. In the 5 months after the fire, there was a disaster recovery center here to help residents regardless of insurance coverage, but now it's closed. And in an area that already had a psychiatrist shortage before the fire, recovering from a disaster like this has been particularly tough on residents.
There's a lot of substance use that we've noticed has really ticked up for people. And yes, stress or adverse childhood experiences like things like the fire can really impact people's mental health and could make people who are normally having a pretty good time in life really struggle. And the more people struggle and are stressed for a longer period of time, the more they are at risk for developing mental health issues.
Butte County Behavioral Health Interim Director Scott Keenley says they're also dealing with a stigma around seeking care. Before the fire, more than 600 people were receiving county mental health services in Paradise. As of September 2019, that number was 78. Keenley believes there are more people in need, but that they are unwilling or unable to access services out of the area.
The farther up in the hills people are, the more they tend to not trust government or want to be left alone or don't necessarily want help.
Rebecca Schmidt studies how wildfires affect the physical and mental health of pregnant women and their babies. 1 year after the Camp Fire, she's still collecting data from survivors, but she says there are some similarities among all mothers impacted by wildfire.
We see that moms that were exposed to the fire in 2017 still had their highest symptom a year later was stress and anxiety.
The Camp Fire weighed on the same people who are trying to help too. Scott Keenley says 60% of his staff lost homes. He says what they learn here as they rebuild lives could help the next community that faces disaster.
I think all county mental health systems need to look at is training their workforce in trauma-informed care and some of the techniques to deal with trauma related to disaster event. California is long overdue for a significant earthquake, and unfortunately when that happens, whatever county that strikes in is going to have a similar level of destruction or disaster.